ase sekta yobocheno gukwana niga aenikire buna gesa omuroberi uyo chakiwa kwomo gusomuroberi osha nigo umubaro w'abantu okinire abuo banyorire obokoreri asinyagitari nonya nabo nigo aerero buya bwasha korenganiwa n'omuroberi omukoro wo NHIF.
Today, in 9 months since SHA was formed, Your Excellency, 17.5 million Kenyans visited health facilities, over 10,000 health facilities. Of these 17.5, 12.5 million Kenyans accessed free primary care paid by the government of Kenya. They went to dispensaries, they went to health centers, they went to sub-county hospitals as outpatients, they went home without paying a coin. I don't know whether that is transformative or that is reducing the gains somebody else has made. Your Excellency, the other 5 million went through social health insurance fund by accessing specialized care in our level 4, level 5, and level 6. In 9 months, under SHA, we mobilized 70 billion Kenya shillings. 3 times or 4 times what NHIF